Examination of the skull and spine. Examination of the skull and spine is an important part of neurologic examination. Examination of the skull includes the following: inspection, palpation, percussion, and auscultation. We usually inspect the skull for evidence of hydrocephalus, microcephaly, acromegaly, or any other deformities of the skull. Palpation of the skull is done to search for evidence of bony defects of the skull or bony bosses, such as in cases of meningiomas with overlying bony bosses of the skull. And we should also palpate the anterior fontanelle, particularly in children. Percussion of the skull is important also in children, where we have to percuss the skull for evidence of the so-called cracked bot sound, which is common in children with hydrocephalus. The last item in examination of the skull is auscultation of the skull. Usually we auscultate the skull for evidence of bruit, such as in cases of angiomatous malformations or vascular tumors intracranially. The common sites for auscultation of the skull are the temporal region, and the orbits, as well as on the mastoid processes. We should also auscultate both carotid arteries for evidence of carotid bruit, such as in cases of carotid stenosis. We proceed then to examination of the spine. Examination of the spine includes the following: inspection for evidence of deformities such as kyphosis or exaggerated lordosis or scoliosis or kyphoscoliosis, and also for evidence of spasm of the paravertebral muscles. Then we palpate the spine for evidence of localized tenderness or localized swellings. Then we test the movements of the spine by asking the patient to flex his spine and try to touch the tip of his big toe with the tip of the index finger, or to hold an object from the ground. This is a test for flexion and extension of the spine, and we can also test the movement of the cervical spine by passively flexing it and extending it and rotating it to one side and to the other side, and noticing in every case the evidence of pain on movements of spine. We should also observe evidence of flexed rigid attitude, which is common in Parkinsonian patients. Then we proceed to examination of the patient's gait. We ask the patient to walk this way and observe his gait. Then we ask the patient to walk on a straight line with the heel of one foot in front of the tip of the toe of the other foot. This way, and notice any swaying during walking this way. We can also test the patient's ability to walk on the tips of his toes. Then we test his ability to walk on heels. Walking on tiptoes and on heels gives a good idea about the muscles of the lower limbs. Needless to say that general examination is of utmost importance in neurologic cases. General examination should include examination of the radial pulse, the temperature, and the blood pressure before examining the heart, chest, and abdomen. We should examine for evidence of lymph node enlargement in the neck, in the axilla, in the groins. We should examine for evidence of swellings all over the body. We should examine for evidence of skin pigmentation. We have to examine for evidence of thyroid enlargement. We should examine the breasts, particularly in females, for evidence of cancer breast or any swellings in the breast, as the neurologic condition might be a complication of one of such general systemic diseases. Thank you.